So obviously there's two big issues that are working against us, whether for lack of better descriptors. We've got in relation to the Chief Public Health Officer's report, we've got clear indications that we've got high volumes of chronic disease that we're trying to manage in Charlottetown and in communities all across Prince Edward Island. We also have a population that is aging. We've got 1 in 5 Islanders will be turning 65 by the time 2020 arrives. We have a window of baby boomers that are between the age of 50 and 70 that are moving through our system. And if you look at what government has done over the last 10 years, government spending on healthcare has doubled. When we came into government in 2007, the provincial budget on healthcare was approximately $360 million. Today, we will be moving in towards $570 million. So the challenge for us is how do we continue to provide appropriate care, protect our acute care beds for our most sick Islanders. Today, we would have 200 medical beds, which we would identify as acute beds, and approximately 80 of those 200 beds are being used and tied up with non-acute patients. So we're seeing long wait times in emergency rooms. We're seeing challenges and cancellations for elective surgeries. So as healthcare evolves, and I know that in this part of the province, like the eastern part of the province, 30 years ago, we were delivering babies and performing surgeries here in facilities. Healthcare has evolved and will continue to evolve moving forward. Governments, current and past, were faced with tough decisions, and that discussion is presented at all of the community meetings. But government's responsibility is to make sure that we have services for Islanders in the appropriate situation, at the appropriate time, at the appropriate location.
So just as a reminder of people of what are some of the other things that are happening across the province, Stewart Memorial will be converted into a 23-bed long-term care unit. Community Hospital Leary and Surrey Hospital will be equivalent as extended care hospitals. The Western Hospital and Kings County Memorial Hospital are going to continue to provide acute care, and the acute care is obviously in support of the fact they have an emergency room that needs acute care beds available to support those patients. Prince County Hospital and Queensville Hospital will continue to be our acute care centers with specialist care. We said in this slide in here, we had a couple of visitors on Tuesday from Ottawa, Dr. Kitts and Dr. Jeff Turnbull, who have come down to PEI to see what's going on. They've heard about some of the stuff that's in the news around how we're using our hospitals to be better utilized and fully utilized. So they have come down to have a look at what we're doing and talk with us. This is just a picture of the Ottawa Hospital. The Ottawa Hospital has around 1,200 physicians in it. They have 7,700 nurses. It's a $1 billion a year operation, and they have in their beds 130 patients who are needing alternate levels of care on any given day. So that's 130 people, and they have regularly 40 to 50 people in the emergency room waiting for care in the hospital. So they're looking at a number of hospitals just outside the Ottawa area.
As I said, my name is Matt Crossman. I'm the general manager for Island EMS, and I know Dr. Wedge said that a few of you have seen her presentation before, but I know there's some attendees tonight who haven't seen it. Previous to Island EMS, which was previous to April 2006, we had 5 ambulance operators on Prince Edward Island. They all did a great job in their respective communities and provided a quality of service. There were a number of benefits to amalgamating the service into one provincial service. For instance, previously, there were 5 previous operators. When one of those operators or one of those system vehicles would leave the community and travel to another area outside their jurisdiction, they weren't able to respond to calls. So if they did a transfer, let's say from Leary to Charlottetown, and they were coming back empty and there was a call in Tyne Valley or Summerside, they weren't able to respond to those calls because it was outside their jurisdiction. The benefit to having a provincial system is all of the vehicles are utilized for the goodness of the residents of Prince Edward Island, and I'll talk a little bit about how we utilize that. Previous to 2006, there was no centralized medical dispatch center, so there were different ways that each service dispatched their medical calls, and we amalgamate that into one centralized service now, which I'll talk a little bit more in a couple seconds. There was also no centralized equipment, vehicle acquisition, things like that. There was really a variation of what level of service, what type of paramedics, what level of training, and what type of equipment each ambulance carried. So there wasn't a standardization or a process across the island where every community got the same type of care. So in 2006, Island EMS took over the provincial service. We implemented a bunch of additional resources. Currently today, we have a long-term service contract with the government of Prince Edward Island. We have over 140 paramedics ranging in primary care, intermediate care, and advanced care levels. All of our units are staffed with advanced ALS paramedics. We have currently 19 units without any of the additions which have been recently announced, and one of them consists of a multi-patient unit where we can transport 2 patients at the same time. Some of the benefits which we've been able to implement over the last few years is we have a standardized medical dispatch center. Not only is it a medical dispatch center, but Medicom Atlantic also provides the 911 service for Prince Edward Island. So when you place a call into 911, the call comes into one center. Within that center, we provide the ground emergency medical dispatch for the entire island, as well as 34 out of the 36 fire departments are dispatched out of that one location as well. So when one call comes into the center, all of the communication officers are able to hear that call, see that information, and are able to dispatch those crews that much more quicker.
And I'd like to ask Ms. McCrae what the qualifications are for the doctors, and please explain them for foreign doctors and this 1 to 2 year experience. I'd like this explained, and so that we know why it's reading like it does. In some places it had read, there were exceptions for UK, USA, South Africa, and Australia. But up here it read 1 to 2 years experience. I called Pat Murphy and he had that straightened out. But now it just reads 1 to 2 years experience.
At one time at PEI, and going back a number of years, physicians who were trained in various Commonwealth medical schools didn't have preference in Canada. But that changed several years ago, that we no longer we have to treat everybody equal around the world. So no matter where they train around the world, their medical training has to be considered the same. So basically what happens is you can't discriminate against non-Commonwealth country members. So that law changed in Canada several years ago. As to why it was on the website, I'm not sure though. I think that's kind of your question. But the reality is any applicant has to be assessed on its own merits, no matter where in the world they train. Under PEI law, which is the same as in the other province for the Medical Act, they have to be in a WHO, the World Health Organization, recognized medical school in order for the training. So they have to be from a WHO school, and now they can be assessed in Canada. Experience is there. I don't want to speak for the college because I realize there's not a college, but the 2 year experience is there because we don't have a medical school to assess their training, where they do have medical schools in other provinces, where if they have an applicant that they feel is acceptable, they'll work alongside the medical school staff, assess their training, and then give them a license to practice either temporarily or under a mentorship program. We don't have a medical school here. So that's the main problem. I'm not sure that I completely answer your question there.
And just, I don't know if this is on. I think Marty knows what I'm on.
Okay.
Yeah. So just on the ad, we did have an error. That piece hadn't been taken off of the ad. So we revised the ad and they're all consistent now as far as the qualifications go. Okay?
Is there any one thing will be different from what we're doing now? For example, I know a friend, let's say they have a bladder infection and they had to go in just for some IV or whatever. Will that type of thing be able to happen?
If they have a blood infection because they're diabetic and their diabetes is under control and they've got heart disease or chest pain, that's not going to happen. But if it's a plain, simple blood infection that's not responding to oral antibiotics and they need IV for a few days, that's going to happen.
That's going to happen. Thank you.